what we're going to take a look at is the use of gallbladder 30, primarily for treating low back pain and also for treating more hip pain in itself. Now, the location of this point is 2/3 of the distance from the sacrocoxyl hiatus and the apex of the greater trochanter. Indication wise, it is used for a number of things, particularly once we start to look at sciatica. It is in a location where the sciatic nerve actually passes, and it can either pass above, through or below the piriformis muscle. If that muscle goes into spasm, this is an excellent point to actually address that. You do have two trigger points in the piriformis muscle, and also you've also got the urinary bladder 54, which most people tend to use that more than your gallbladder 30. But however, if you look at the function of those 2 points, you will find that gallbladder 30 is a much more effective point to use. Same again, you've got your trigger points at each side, and again, this point will also deactivate those trigger points and also relax off the muscle. Thereby, if it is the piriformis that is the primary cause of sciatica, then you will find at least it will relax off that muscle and allow the release of the sciatica that way. But however, you can use it in conjunction with urinary bladder 54 or in addition to the two trigger points at each side. Now, other conditions that is quite effective for utilizing is prolapsed lumbar disc, disorders of the hip. So if you are treating hip problems, it is an excellent point. I normally combine that with gallbladder 29, and then I'll use ashy points or tender points around the hip, so I'm kind of getting more of a surround the hip effect, and also use something such as gallbladder 41 as a distal point. So that combination is quite effective for treating hip disorders, particularly where the bursas around the hip may well also be inflamed. But coming back to inflammation, and if you're looking at any inflammation of the hip, inflammation of the back, this point has been shown in a number of studies to be quite effective at reducing inflammation. And you combine it with other points such as stomach 36, very effective at bringing down any swelling inflammation in and around the low back or the actual hip itself. So if there's any inflammation of nerves, then again, this is a point that you want to take into consideration if it's affecting anywhere around the low back or in and around the hip. So if you've got any injuries of a nerve, compression of a nerve, regeneration of the nerve, then again, this is where gallbladder 30 comes into its own. So it is quite an important point for restoring anybody presenting with sciatica or damaged nerve, whether it's been from a car traffic accident or something such as that. Now, once we start to look at pregnancy, excellent point for treating low back pain during pregnancy. There's many points you can't use in the low back for pregnancy, mainly because they tend to stem from that region of the low back and supply the uterus, so therefore those points aren't recommended. But however, gallbladder 30 is an excellent point for treating low back pain in people who's actually pregnant in itself. If we're looking at the depth and how deep you actually needle, it's a perpendicular insertion, and you can needle down to anything between 1.5 to 2 centimeters in depth. You don't need to go any further than that, because that's how deep the acupuncture point will actually sit. Any deeper isn't going to give you any greater effect. So that's just something to bear in mind. They have been shown to be quite effective, and that also applies to if you're treating a piriformis. So even though needling down to 1 centimeter to 2 centimeters will also have an effect on relaxing off the piriformis, you do not need to needle all the way down into that muscle in order to have the effect while needling that particular point. So I hope you find it useful, and I hope you get some success from utilizing gallbladder 30 when combining it with other points.